Hypertension affects 75 million Americans, and it's a major factor for heart attack, heart failure, stroke, kidney diseases, and arterial disease. And 90% of people who have hypertension have what's known as essential hypertension, which simply means that no identifiable cause has been recognized. Well, the heavy metals you're exposed to not only increase your risk of hypertension, but the toxic metals also make having hypertension more difficult to treat and pose a risk to your organs and arteries. I am Dr. Ayo Bankole, and I'm a state licensed naturopathic doctor, and I focus on root cause analysis and care for the cardiovascular system. Here's why you should care about toxic heavy metals. The toxic metals you've been exposed to and store in your body could be why you have high blood pressure. The toxic metals you've been exposed to and store in your body could be why your blood pressure is hard to control. And the toxic metals you've been exposed to and store in your body can also increase your risk of heart disease even if your blood pressure is under control. Numerous population studies have demonstrated the link between long-term exposure to lead and increased arterial pressure or hypertension. Lead raises the risk of elevated diastolic, which is the number on top, and systolic levels, the number on bottom, and does so by causing inflammation and oxidative stress in the arteries. It damages kidneys, it reduces nitric oxide levels, and it alters the renin-angiotensin system. Risk is greater in postmenopausal women, where the risk of elevated blood pressure has been correlated with the amount of lead in their bones. And with menopause, the lead leaks out from the bones at a faster rate, where it then interacts with blood, kidneys, arteries, and heart. The normative aging studies showed that individuals with the highest bone levels of lead had the greatest blood pressure elevations. One study showed that stress compounds the effects of lead, increasing blood pressure risk by 2.6-fold. Mercury is also concerning. Mercury results in several negative effects that contribute to arterial hypertension. The vascular effects of mercury include oxidative stress, inflammation, clotting, vascular smooth muscle proliferation and migration, endothelial dysfunction, abnormal cholesterol, the oxidation of good cholesterol or HDL, immune dysfunction, and mitochondrial dysfunction. The clinical consequences of mercury toxicity include hypertension, heart disease, heart attack, an increase in the carotid intima-medial thickness, carotid artery obstruction, stroke, atherosclerosis, kidney dysfunction, and an overall increased risk in total mortality. A National Health and Nutrition Examination survey showed for each 1.3 microgram per liter increase in mercury, systolic blood pressure increased by nearly 2 points. And in premenopausal women, a twofold increase in serum mercury levels increased the odds ratio of hypertension by 3.08. Compared to no resistant hypertension, for every 1 microgram per deciliter increase in blood lead, the proportion of resistant hypertension increased by 16%. There is cadmium also. Each 1 microgram per deciliter increase in blood cadmium levels is associated with a 13% increase in the proportion of resistant hypertension. And when analyzing all three metals, lead, mercury, and cadmium, there was a significant combined effect. For these reasons, toxic metals like lead, cadmium, and mercury should be considered as a factor in contributing to your hypertension and arterial disease. So you may be wondering, well, how do I know if I'm at risk of heavy metal exposure and storage? You can be at high risk based on your occupation. If you drive for a living, if you work in construction, printing, plumbing, agriculture, or painting, you have a higher risk of toxic metal exposure. But those of us not working in high-risk occupations are also exposed. We all breathe air contaminated by coal-burning power plants and auto exhaust. Many of us have several amalgam fillings or more. Many drink groundwater that's been contaminated. Lead pipes exist in many regions, and many people eat large predatory fish and shellfish. Those who smoke or who are exposed to secondhand smoke, those living near sites of industrial contamination, and those who take some forms of Chinese and Ayurvedic medications may be contaminated. those who use contaminated dishware, or those exposed to dust from old lead-painted homes. Heavy metal testing is available. Provoked toxic metal testing is where you receive a chelating agent before collecting your urine. It's a more accurate reflection of the amount of metals you stored in your body compared to unprovoked blood or urine sample, and it's more accurate compared to a hair mineral analysis. The point of this information is not to scare you, but rather to make you aware of other common identifiable risk factors to consider in the treatment of hypertension and heart disease. For my free guide, What Doctors Don't Tell You About High Cholesterol, High Blood Sugar, and High Blood Pressure, see the link in the description below.